is a concept that's not really discussed much in the medical field, and probably the general public doesn't know much about it. But the type of trip that you have, say, if you do ketamine at a party, at a rave or something, versus ketamine in a therapeutic setting is going to be completely different. And because of this set and setting, where set is your mindset and setting is the environment that you're in, the exact same person can have a completely different response to the exact same medication at the exact same dose, depending on what their mindset is and what setting they're in. And so being in a therapeutic setting where we pay attention to the details that make someone feel safe, that help to instill that sense of safety and trust, can really lend them to having a better experience and what we might say is like a better trip.
A lot of people show up with kind of the stigma that's residual from the war on drugs, talking about like, oh, you're doing drugs for your mental health. Isn't that counterintuitive? And we have to work through that, right? And so that's part of the prep work that I do with each of my clients, and we all do with all of our clients. Both in the sessions and even on the same day. For a lot of people, they come in very naive of psychedelics, not really sure what to do with this information. Oh my gosh, is this changing who I am as a person? Or, alternatively, I mean, there's a lot to be said about harm that's been done just in mental health field in general. And so how can I develop trust with a person and make sure that they feel comfortable being in this other state of consciousness around me?
The clients that we're seeing are actually clients that have tried and failed a lot of other types of things. We're seeing patients that are very frustrated with the success or lack of success that they've had with other treatments. We're seeing patients who've tried medication after medication, different types of therapy after different types of therapy, and aren't responding. And so we're really seeing clients that have very severe symptoms, who may have lost hope, and who are just really struggling and maybe coming to us like as a last resort.
This all happened during COVID, probably smack dab in the middle of it. We'd had a year of isolation, so that was making my anxiety go through the roof. But I had also lost my job at the beginning of COVID. So I'd had a very intense, I guess we usually call them nervous breakdowns. Right after I lost my job, it was the first time I'd ever lost my job. I'm an overachiever. Like, it was just one of those things where it really was way too tied to my self-worth. Started therapy, and the therapist that I was seeing individually, like I mentioned, the possibility of doing a psychedelic because I had been reading all possible alternatives.
I've hit rock bottom a few times in my life, and that last time I was just like, I cannot keep living like this. There's something wrong, and I know there's an answer out there. I've been going to therapy since I was 15 till I found something that worked for me. And, a lot of people don't have 10 years to figure it out.
Part of the training of becoming a psychedelic therapist is going through the experience yourself. And so I actually was really surprised. I had already been working with ketamine at this time, but I received a dose intramuscularly like we administer here. And I had gone in with the intention of healing my relationship with my body and finding more peace in that. And while that was the topic that it did take me on, it also ended up addressing a phobia of mine, which I was not intending to work on. And so before this, I could not say the word vain. I couldn't look at them. I literally had walked off on jobs because of a colleague chasing me out of the door with their arm. And in this journey of mine, I saw myself deconstructed and reconstructed and journeying inside my vascular system. And I walked out, and all of a sudden I didn't have that phobia anymore. It still wasn't super comfy, but I felt totally like, without even fully intentionally going on to resolve the phobia, it came out of there. And so I think that really shows me exactly how ketamine can direct us to where we need to go, direct us to those parts that maybe we've been avoiding, and really quick results.